Good morning, everyone, and thank you for taking time out of your busy schedules to participate in this important session. I'm delighted to greet you in behalf of the Bloom, Kentucky Coalition of 32 grant-making organizations from around the Commonwealth that came together 4 years ago in a unique and historic public policy advocacy initiative to reduce, if not eliminate, the impact of ACEs and to give our children and families reasons to have hope for their futures. The coalition is indebted to the leadership of the Kentucky Youth Advocates for facilitating the success of this vital initiative. It is my hope and expectation that you are participating in this session out of a sense of urgency, with a commitment to upstream thinking, with a conviction to stop the endless cycle of reacting and to start the revolution of preventing, and to move from just taking care of the problem to ending the problem. And it's to that end the coalition commissioned a research project to identify the economic impact of ACEs in Kentucky, specifically in Kentucky. Information is power, and it empowers only if you can take action with it. Then it represents knowledge and consequently power. We intend to use the knowledge from this study as a major tool in our advocacy toolbox going into the 2026 legislative session, and to build on the momentum and the relationships we have cultivated, particularly with the members of the Joint Committee on Families and Children. And now let me turn to our colleague, Hannah Edelin, Advocacy and Policy Director of KYA, to provide a high-level overview of the report. Hannah?
Hello and good morning, everyone. I'm Hannah Edelin, Advocacy and Policy Director here at Kentucky Youth Advocates and one of the leads of the Bloom Kentucky initiative. In this first section of our webinar, I'm going to be reviewing some of the major report focus areas. The report did come out on Monday, so hopefully you've had some time to dig into that report. But today we'll be talking a little bit about understanding ACEs to prime the conversation. We'll talk about levels of prevention, the prevalence and cost of ACEs in Kentucky, as well as how ACEs show up across communities. I'll later in the next part of this webinar kick it to my colleague, Dr. Shannon Moody, and members of the Bloom Kentucky Coalition to detail some of our policy and budget investments. While presenting, if you have any questions at all, feel free to drop those in the chat. My colleagues supporting this webinar will be providing some support in answering those questions. And if for some reason we do not get to your questions today, feel free to reach out to me personally at hedlin@kyyouth.org. And we'll also follow up at the end of this webinar with an email with all of the resources included. So with that, let's get started. The report begins with a primer on adverse childhood experiences. For those that may be new here, adverse childhood experiences, or ACEs for short, comes from a 1998 study that examined early factors that contributed to long-term health outcomes. This landmark study revealed a really powerful link between childhood adversity and health issues across the lifespan, including things like chronic disease, mental health challenges, and even early death. So ACEs are those potentially traumatic events that occur before the age of 18. And in the original study, they were grouped in the 3 categories that you see on the screen: abuse, physical, sexual, and emotional; neglect, physical and emotional; and areas of household challenges such as divorce and separation, substance use, incarceration, mental illness, or domestic violence. When we talk about ACEs, it's hard to separate these individual experiences from environments that situate our kids and families. We know from research that there are things like adverse community environments, things like poverty, community violence, as well as lack of resources such as housing and other family supports that make it hard for families to thrive. We always like to say at Bloom Kentucky that just like trees need healthy soil to grow, so do our kids in Kentucky. They need those same healthy environments in order to flourish. When responding to these types of environments, we can use levels of prevention to guide how we respond. On the screen, you're going to see various levels of prevention ranging from primordial, which is focused on reducing those risk factors across an entire population. And we can see here how policy and budgetary investments at this level can affect across many populations. To the tertiary level, which is more individualized and works to minimize long-term effects of a specific condition. As we consider the economic impact of adversity, we can use these types of levels to address ACEs across systems before they begin, as they emerge, and in the long term after they occur. Understanding the prevalence of ACEs in Kentucky can help us understand the scope of the problem and inform the direction of solutions. We know that adversity is common. More than 20,000 adult Kentuckians were surveyed in 2015, 2018, and 2020 using the Behavioral Risk Factor Surveillance System, also known as BRFIS, to determine the extent of their ACEs experienced prior to age 18. From the analysis, we know that 62% of Kentuckians reported at least one ACE in childhood, and nearly 1 in 5 Kentuckians reported experiencing 4 or more ACEs. And we know that if not addressed, children exposed to trauma have increased risk of negative health outcomes, including things like maladaptive behaviors, like using substances, increased risk of suicidal ideation, as well as other mental health challenges. There are steps we can take to reduce the impact of ACEs to ensure that our kids in Kentucky can grow up happy and healthy and hopeful. In the report, we also detail the most reported ACEs in Kentucky. These include divorce or parental separation, substance abuse in the household, emotional abuse, a household member with a mental illness, amongst others. And we know from research that ACEs rarely happen in isolation. They often occur alongside one another. I mentioned earlier the relationship between ACEs and adverse outcomes. The research consistently demonstrates a relationship between the two, and it's important to note that exposure to ACEs in childhood does not guarantee negative health and social outcomes. It's a predictor of risk. We know that adversity can be buffered by many things, and we talk about that in the report. Things like positive childhood experiences, building resilience, as well as access to family and individual supports, many of which are made possible through policy and budget investments. On this slide are figures that show the relationship with ACEs and various health outcomes, including smoking and asthma. Both figures demonstrate how ACEs are linked to an increased risk. So we can see here in this figure that among Kentuckians who reported more than 5 ACEs, 41% reported currently smoking. And then Kentuckians who reported 5 or more ACEs reported currently having asthma. This figure shows the relationship between ACEs and an increased risk of depression. 43% of Kentuckians who reported more than 5 ACEs reported experiencing depression. And we can see from this data point just one example of how unresolved adversity in childhood can shape lifelong mental health trajectories. Now, this table, I always say, is like the core of this report, but it shows the attributable to ACEs cost by disability adjusted life years, that daily variable, and medical spending. So daily reflects the loss of potential due to poor health, disability, or premature death. Loss of potential here means participation in the state economy from missed years in the workforce and lower lifetime earnings. And medical spending here refers to the cost of treating these illnesses annually. And you can find more about the methods in the full report. The total annual economic burden of ACEs in Kentucky is $295 million, with an estimated $2.7 million in medical spending and $292 million in disability adjusted life years. Researchers, Peterson and colleagues, they compared these lifetime economic burdens across the nation and found that Kentucky bears one of the highest per person lifetime economic burdens due to ACEs. While this reality we know is difficult to digest, we believe and we know that we can counterbalance the negative effects of adversity. We can reduce the long-term cost, and we can create positive, nurturing conditions that surround our families in Kentucky. The next few slides are going to show how ACEs show up across communities. We know that risk and impact are not experienced equally, and that factors at various levels, individual, family, and community, can increase and protect against the risk of ACEs. Communities of color, low-income communities, and rural communities are often deeply affected by these risk factors due to persistent social and economic barriers. In this figure, we see that Kentuckians with at least one ACE are less likely to obtain higher levels of education. In this figure, we can see that Kentuckians with at least one ACE are more likely to be out of work or unable to work. We can see from this figure that this is real, and we have significant economic implications as a result of adversity. In this figure, we see that Kentuckians with at least one ACE are more likely to have lower incomes. And in this final figure, we see that Kentuckians of color are more likely to have experienced one or more ACE than their pure white Kentuckians, with Kentuckians who are multiracial having the highest rates. By understanding the root causes of these challenges, and often that means looking upstream to our systems, we can move beyond focusing solely on individual factors and instead focusing on those broader environments that situate our kids and our families. The key takeaways from the report, and that you'll find in the executive summary, we bring those out and highlight them, and they're as follows. We know that experiencing adversity in childhood can increase the likelihood of health challenges and economic hardship later in life, especially when that support is lacking. We know that adversity in childhood is common, and it carries real costs for the health and vitality of Kentucky. And just to reiterate some of those key data points, between 2015 and 2020, 62% of Kentuckian adults reported having at least one ACE in their childhood. 19% of Kentucky adults reported experiencing 4 or more. And we know that the total annual economic burden of ACEs in Kentucky is nearly $300 million. But there is so much that we can do to buffer the impact of adversity. We can support families and build pathways to lifelong health, resilience, and community strength. And we can do that through proven policies and practices that support strong foundations for our families. So I'm going to take a moment for just a quick pause and ponder. And in the chat, I'd like you all to respond to this question. What opportunities do you see for Kentucky's kids in this report? Feel free to drop those opportunities in the chat now. I see some answers coming through in the chat. Investments in school-based supports. Absolutely. We know that kiddos spend a lot of time in school, so there's a significant opportunity here to impact kids in schools. Opportunities for a better life in the future. We need to make sure that we address both the individual and the environment. Absolutely. Early detection of ACEs, early support via the community, out of school programs. I see we've got our Girl Scouts on here, and I know they do a wonderful job creating positive childhood experiences. Collaboration, detection of ACEs and knowledge of PACEs, opportunity for collaboration, training community members and physicians, access to quality childcare, getting outside, absolutely. Wow, lots of opportunities and so many that are in alignment with some of the key strategies and investments. And we're going to talk about that in this next section. So to take us in the strategies for preventing adversity and advancing resilience, I'm going to kick it to my colleague, Dr. Shannon Moody, and panelists from the Bloom Kentucky Coalition. Here with us today, we've got Jeff Polson, Sara Hemingway, and Kristin Walker-Collins. And I know they're going to detail and tell you a little bit about their work further. So with that, I'm kicking it to you, Shannon.
Thanks so much, Hannah. I know we are looking forward to hearing from our folks who are part of the Bloom Kentucky Coalition and are grant makers and have been actively involved in the Bloom Kentucky process. Hannah, if you'd stop sharing your screen, we can bring up our panel members here and get to see their faces and get to know them as they introduce themselves. But why don't we go ahead with brief introductions of our panel members, and we'll start with Sara Hemingway and then hear from Kristin Walker-Collins and then finally hear from Jeff Polson.
Good morning, everyone. I'm Sara Hemingway with the Marilyn and William Young Charitable Foundation in Owensboro, Kentucky. I've been in my position for 21 years, and I'm delighted to be part of this panel.
Hi, everyone. I'm Kristin Walker-Collins. I'm the CEO at the Foundation for Appalachian, Kentucky. I have been with the foundation for 10 years in various roles, most recently stepping into the CEO position. Our focus area is the Appalachian Regional Commission counties in Kentucky. There's 54 of those. We really concentrate in the bottom part of the state, below 64 and east of 75, but we do stray from that every now and then. Our funding focus is really anything involving community. We work through our community affiliates. We have 12 affiliates that cover 20 counties in southeastern Kentucky. But then we also do work around access to quality, affordable childcare, food security, housing, criminal justice reform, but really in the form of how do we as a community support people and families that are dealing with incarceration, and also those that are in active addiction or recovery. And so what can we do as communities to help with that? And then in addition to those things, we also do economic development, entrepreneurship support, and most recently, and for solidly the last 5 years, disaster recovery work. And I will hand it off to Jeff.
Good morning, everyone. I'm Jeff Polson with the Jewish Heritage Fund here in Louisville. We're a health conversion foundation that was established in 2012 with the sale of Jewish Hospital. We have 3 focus areas. One is around health and a specific focus on adolescent health. And we define adolescence as that time period of ages 12 to 25. We also support medical research, particularly with the University of Louisville. And then the third area is around supporting Jewish communities across Kentucky. We are focused primarily in Louisville, but we do have a statewide footprint. I'm really excited to be here.
Yeah.
Shannon, I missed the question about what we fund, so I'm going to go into that real quick.
Please go ahead.
Our focus areas at the Young Foundation are family support systems that can entail a lot of different things. We focus a lot on the social services in our community, whether it's homelessness, after school programs, etc. We also fund access to arts programs, which we believe are critical for people to feel a sense of belonging. And then we also fund leadership development. So apologies for missing that earlier.
Thanks for including that in, Sarah. And we are really grateful to have Sara, Jeff, and Kristin all as part of the Bloom Advisory Council that Barry Allen has been leading over the last couple of years here. And we are lucky to have the engagement from across the state that we do. Barry has done a fantastic job recruiting these great advisory council members that we've got at the table. And then I also am glad to note that we've got other Bloom philanthropic and grant making groups here joining us for the webinar today as well. So really glad to see our Bloom core here. And why don't we go ahead and jump in? So, when I sat down to read this report, in the early stages, the thing that popped out to me most glaringly, and I think is also just coming up for most folks when they read the report, is almost $300 million a year that we're spending on the mitigation of adverse childhood experiences. So based on your all's perspectives and where you serve, and what else that you heard in the report, whether it was, your biggest takeaway seeing that dollar figure or other takeaways based on the data, what did you see as far as the impacts of ACEs and how they show up in your all's community? And whoever would like to jump in first, please go for it.
I'll go. So I live in and serve and work alongside Appalachian communities. And the report, I think, affirms all of the things that we see through our work, that we are seeing in real time what unresolved childhood trauma and ACEs translate into in generations, right? So we're seeing poor mental and physical health. We're seeing workforce instability, and then this generational poverty and cycles of poverty that we're seeing. It shows up as chronic illness. It shows up as depression, coping mechanisms, the opioid epidemic, right? I think it's not only an ACE, but it's also a symptom, right? Like it's all of those things. And when you put it into a economic impact, I think it is a really stark realization of how much how important our children are in forming how we become as adults, and how they form as adults, and how our communities are created. And also really pointing out the fact that ACEs aren't just an individual problem, right? Like, or an individual outcome. It's truly shaping the trajectory of our communities, and the impact that it has. And so those were my big takeaways. I'm a mom. I have two small children, and we were at gymnastics when I was reading this, with my highlighter and my pens and my headphones on, just tuning in to what is actually in this report. And I can't wait to share it with other people so that they can truly see the depth and the breadth of the impact that ACEs are having.
I'll jump in and just echo everything Kristin said, and would simply add, I think it shows up in our community in the increasing rates of disconnection in young people, folks who aren't working, who aren't going to school, who aren't engaging in the community in other ways. I think we see it in the increasing need for mental health access across all the populations, but particularly around adolescents that we serve. I think we see, as you do across the state, the increase in addiction rates. I am hopeful that with the Opioid Abatement Commission and the funds that are flowing from a state standpoint and through local communities, that may be at least some funds that are going into that particular area, both around treatment and prevention. And then I think also, particularly in the Louisville area, the increase in violence overall, particularly gun violence. While the numbers are decreasing this year over last year, there's still a significant number of folks who are impacted by violence. And it's not just, as we know, the actual folks who are directly impacted, but it's their family, it's the community that they live in. And so while the numbers are better this year than last year, that's still a significant concern for us in Louisville.
Yeah, I agree, Jeff. Just one gun violence is one too many. So my takeaway is echoing what both Kristin and Jeff said, is that you can see it happening in our community, and I witness it mostly. I have young adults, and seeing them go through their teenage years, I feel like the level of anxiety and how that contributes to ACEs is significant, and much more than when I was a child. Anybody on here who's a Gen Xer like me will tell you, my mom didn't know where I was from 1982 to probably 1988. I mean, we just, especially in the summer, we just had no cares in the world. And I feel like these children, as Jeff said, are so much more disconnected. Even though they have all the connections with social media, there's so much more loneliness and high levels of anxiety. The other thing that I was affirmed by reading this and seeing that $300 million figure is that philanthropy can't do this alone. That to me stuck in my mind. While all my colleagues on here who run foundations will tell you, we do have resources, and we do try to implement those in the best possible way. $300 million isn't even, we can't even touch that. So we have to work with the government and the state legislature to find ways that they can also assist us. It has to be a public-private partnership.
And related to that, and I know Kristin talked about what they see in Eastern Kentucky and the generational poverty, and what Jeff sees in Louisville and what you see in the Owensboro area. But when it comes to the economic impact of ACEs and how we see our government having to respond to that, or those public-private partnerships, what else comes to mind for folks as far as like the challenges that you see in the community when it comes to those maybe funds being diverted and used to mitigate ACEs? How does that impact the rest of your communities?
I see it, Shannon, as lost potential. We want to see everybody that we support thrive and be fully engaged in community. And the impact of ACEs creates an environment where that simply doesn't happen. And that's reflected in wages, in health, in mental health. All of that creates a drag on the community, but also on our economy. One of the things Hannah highlighted was the pyramid that's in the report. And I thought it was fascinating, particularly the base of the pyramid, which, as Shannon referenced, is the primordial prevention, which was a new term for me, but it aims to reduce risk factors across the entire population. And it's typically supported by state and federal programs and investments. And so if you think about where we are today, from a federal legislation standpoint, the potential implications of the tax bill that's working its way through the House and Senate could have significant impact on Kentucky, and the funds that are available for the General Assembly to invest in exactly what we're talking about today, the prevention of ACEs and the creation of more positive childhood experiences. And so the potential impact to us as a Commonwealth can't be understated as it relates to the federal legislation that's currently being considered.
I don't even know how to follow that up. I mean, that is really the situation that we're finding ourselves in. And, looking at what's happening at the federal level, if Medicaid gets cut, we're looking at losing hospitals in Eastern Kentucky specifically, right? Like up to 35 of them. And that is, and I don't want to turn this into a conversation about that, what's happening, but it is very real. And so if we have this information, like this report, to take to our legislators around the economic impacts that are happening just right now at current federal funding levels, right? What is going to happen when we have reduced funds? And then what is it going to take from government to echoing Jeff, the primordial, also new to me, to this primordial level of investment that to reach the state system as a whole, right? And so what is it going to take? What is that gap now? And then what is that gap potentially going to be? And then, of course, my concern is always, where does rural fit into this, right? And you know, a lot of times that's the voice that I bring to conversations as being the rural representative in the room, right? Making sure that rural is in rooms where decisions are being made, especially about us and about funding levels. And how do we get that to the more rural areas of our state that are already disproportionately impacted by ACEs, right? This report shows that. And how do we, you know, how do we advocate for ourselves? How do we use our partnerships across the state to advocate for rural as well?
I think that what we have done in the foundation world in my 21 years is that we are now more engaged with each other and also advocating not only for our sector, but our nonprofit sector. I know that Barry has pulled us all together for this, and it's the first time that we have, in my knowledge, done something collectively. And I think that we have legs now. Jeff and I were able to go to Washington, D.C. in February and advocate both for our sector and for the potential cuts to not be so draconian. Like Kristin said, we will have hospitals closed. In Owensboro, we are kind of a mixture of urban and rural. You know, it's all relative to what you're saying. So we will be impacted. I don't know that our hospital will completely close, but it will greatly affect our strength, without question. But I also think that we are making inroads in the partnerships that we have with our government officials. I know that, fortunately, I live in a community that's small enough that our mayor and judge executive consult me when they are making decisions in their budget, which might affect the nonprofits. And so I feel like having a voice there is helpful, to talk to them about, well, if they make this change, here's what's the potential for our children and how it could increase ACEs or decrease ACEs, either one. So I feel that that's one of the things that this report will help me is the actual quantitative numbers.
Yeah. Our philanthropic leaders have such a great opportunity to talk to decision makers in Frankfurt or on the federal level as a collective, because you all are bringing the perspectives of your community, and your goal is pretty clear as far as ensuring that your communities are successful and thriving. So, you know, related to that, what is your all's best hope for how local and state decision makers will respond to this report? What are you hoping to see them take action around, or what does progress look like in response to the report?
I think investing in our children in a way that is meaningful. I think it looks like investments in early childhood education. I think it is also understanding that when we do for the least, it helps the most. And so, especially for our young people, right? Our children, my 5-year-old, granted, she can advocate for herself when she's hungry, right? But her greater needs, you know, she's not going to Frankfurt and talking about it, right? Like, this is the role of adults in positions of power, is to take care of our children. And so how are we investing in them that is meaningful, that will create those positive childhood experiences, right? Is it investing in Century 21 grants at the federal level so that Boys and Girls Club exists or after school programs exist, right? Is it investing in childcare at a state level so that childcare can just exist, right? And stay open, and not always, at the on the verge of closing. And what does it look like for creating school systems and investing in schools that are trauma informed, right? That can help and be that safe space for children that might not get it at home, right? And how do we help our legislators understand that that is important? We can talk to them about the numbers, right? And the impact on workforce and, all of the things, the buzzwords that they love, that they pay attention to. But at the end of the day, it's also about investing in children, right? And so how do we get them to understand that and hear that and actually do something? I probably have more things to say, but I'll hold on.
Yeah, Kristin, I agree. How do we get them to hear this? And I think sometimes when I speak to our legislators, and elected officials, when you talk about the effect of ACEs on the family support system, I think sometimes when you talk about addiction or you talk about mental health, it's overwhelming to them and they don't know how to solve it. And so sometimes they shut down. But if you can talk about the economics and what it's going to do to the workforce, boy, do they perk up. So I feel like we can definitely use this to say, if we can work on these things, we will have a much stronger workforce in the future. And I echo what Kristin said. If we can have some policies around childcare, even the pre-K for all initiative, I think that we will have some success, because it is a dire situation. I know I've heard from Kristin what's going on in her community. We had a very solid childcare center just closed this month, and it just breaks my heart for the parents that have children that age, because that really disrupts your whole family system. And I want to shout out to my colleague Joe Berry at the Public Life Foundation. They're working collectively with our Family Y to change that ecosystem. They're working on training and developing childcare workers, and I'm sure he would be able to talk to you all about that and how you can replicate that in your community. Because if we don't fix that, I'm afraid that that our children are going to experience more ACEs if they are in a home that is traumatic for them.
I think Kristin and Sara have summed that up really well. The only thing that I will add is I really think this is a roadmap for our legislators. And if we can maintain a focus on what do we do to mitigate the impact of ACEs while also maximizing the impact of positive childhood experiences, then we'll have something to talk with the legislators. And I just want to say I'm really proud of the work Bloom Kentucky has already done with KYA as our backbone organization. And just a shout out to Barry for really being the leader who pulled us all together, and the work that's coming from this is driven by his passion and support for what we do.
Yeah, we're really lucky to have the people around the table that we do. And yeah, Barry's been such a force for good in this space. And speaking of that, our 2026 legislative session that is coming up it has the potential to be an inflection point for our kids and families across the Commonwealth of Kentucky. We know that our legislators are going to have to respond to the federal budget in some way or another, in any way that it comes out. And we also know that there are decisions that they can make that can impact change pretty quickly for kids and families when it comes to investments on prevention, and that primordial prevention and primary prevention, but really talking about those programs that ensure that our children can access and have experiences that are positive. So, the three of you all have spoken to this a little bit, but I just wanted to know from from your perspective as a philanthropic organization, what do you see as your role in tackling the impacts of ACEs on the policy side or creating opportunities for positive childhood experiences?
I will say everything we do on our adolescent health agenda is focused on minimizing adverse childhood experiences. We do that through capacity building in organizations, ensuring access to health care, to mental health care, to ensuring that adolescents have input, that they're around the table, that they're consulted, particularly when programs and policies are impacting their health system or their health. And so everything that we're doing is around minimizing ACEs and maximizing the positive childhood experiences.
Yes, I echo that, in the fact that, as I mentioned earlier, my role now versus when I started my position is completely different. I used to just give out grants and talk to our nonprofits about what their needs were. Now I feel like I'm moving into a position where I feel like I have to make that connection with our government officials and be sure that they're not doing anything to harm the ecosystem that we have for our nonprofits. And as Jeff said, the primordial was new to him. The positive childhood experiences was new to me. And I feel like that's one thing I'm going to push for in my board, because that's something that we can tangibly do. We can create more experiences in Owensboro, Kentucky for our children, whether it's through our funding of the arts. And I'm so glad that we do that, because not everybody does fund the arts. Whether it's the quality after school programs, programs in the school that are not funded through their budgets, that's something that I feel like that's low hanging fruit for us without question. So that PCE is new to me. So I appreciate that in the report.
I think we differ in, our grant making strategies from Jeff and Sara, only because we're a community foundation and our grant making is made at that hyper local level in communities by local leaders, right? My predecessor loved to tell everybody we don't actually do anything, but we're that back office to make sure all that things run. But it is true, right? The people in our communities are the people doing the hard work, and so they recognize things that are working in their communities and are actively funding those things, whether it's arts, childcare, early after school programs. There are so many things that are working at a local level that I might not see every day, right? I can probably tell you what's going on in Perry County. That's where I live. That's where raising my family. But I can't tell you what's going on in Floyd County, right? I can't tell you what's going on in Pike County, but we have people on the ground in those communities that are making those funding decisions. My role, similar to what Sara had said, is one, taking information like this to our local boards so that they understand the importance of investing in children, so that can help inform the work that they're doing. But then also showing up in rooms where decisions are being made about rural, right? And making sure that rural doesn't get left out in this conversation, whether it's East Kentucky, West Kentucky, right? Like there's a whole lot of rural in this state. And so making sure that is represented. And so there's a lot of roles that our foundation takes, that and leading, a lot of work, right? Policy and advocacy, but then also what does it look like for a community to take care of someone coming out of incarceration, right? What resources do families need, right? It's not just the person coming out of incarceration that's going through transition, it's also the family, right? And so how are we addressing those needs? And so I think that, as Jess said, like building the capacity of the nonprofits, but then also taking the education, these types of resources that are easy to understand, it's easy to see the impact, and making sure that they know about it so that they can also talk to their legislators about it, right? And giving them the ability to go and speak to these experiences. So yeah.
Thank you for that. And I know that, and I hope that as you all and as the folks who are around the table continue to review the report, pick out those items that really resonate with them and go talk to other people about it, right? It's about making sure that other people are aware of what's happening, and how adverse childhood experiences affect us as a Commonwealth, but definitely within our own communities. So to wrap up, just a last question for the panelists is whether it was, a big aha from the report or just the work of Bloom that you all have engaged in. Is there anything else top of mind that you'd like to share with folks in reflection of the report or the work of Bloom overall?
I'll jump in first. Sorry, Jeff. And I just really want to comment on the work of Bloom. I think when Barry brought it to us, we were kind of like, yeah, sure, we'll sign in, sign on, and truly recognizing that this is the first statewide, combined effort from philanthropy on an issue, that we've found such wonderful partners to do the work in Kentucky Youth Advocates, right? This work would not happen without you all and the team that you all have together doing this. And I don't think I ever had dreamed of getting an economic impact study on ACEs, right? And being able to tackle that. So I am thankful that Bloom has actually come to fruition and become so much more on the heels of the annual meeting, the summit that was held in May that was so successful, and truly just coming around a topic that impacts everybody, right? That they might not think it does, but it does, right? When I go through and look at the ACEs and count up how many I've had in my life, right? And how my trajectory could be a lot different if not for positive childhood experiences also. So just looking at that. So thank you all.
I think that one positive about Bloom, and especially this report, is the educational aspect of it for those of us who think we might know about ACEs, but I'll be honest, I've never been homeless. My parents aren't divorced. I mean, there's issues that I need to become more empathetic about, and this is helpful to me to keep it top of mind. So I have made a commitment to myself to continue to do that. I took a sabbatical last year and I read 2 books on homelessness, that helped me to get inside of what is going on. So I think everyone on this call, somehow is working with children. And I think that we need to remind ourselves that while our lives may be blessed, that we need to continue to try to understand the challenges that many of our families face.
Yeah, Shannon, the only thing I would say is, there's not a magic solution to this. There's not one thing that we can all collectively do to end this. But what we have with this report is a baseline that we can all take and do our own what is our responsibility for each of our organizations. And we have a roadmap now that can help guide us as we all collectively work to fulfill the mission that we're charged with stewarding.
Well, I'm so grateful for the reflections that you all bring, Sara, Kristin, and Jeff, and the perspectives that you're coming with, with the experience that you have in your communities and the investments that you're making in the kids in your area. I wanted to summarize what I think I heard from you all over this brief panel, but some really profound takeaways around this this report potentially being a roadmap, or this report being a mechanism for starting conversations with decision makers, identifying where they could take action, and that there's a lot of different ways to take action. Like Jeff said, it's not a one size fits all. There's not just one answer. There's many answers. And if we are engaging with our legislators regularly and talking to them about how this shows up in our communities, that can start to drive action. There is also some conversation around the ripple effect across the community and the real cost to opportunities for our young people that ACEs have. And then a need for folks to join together and really discuss the impacts as a collective. We're seeing the benefits of our Bloom grant makers coming together and talking about this and really generating conversation and discussion amongst our local and state leaders. And we will continue to do that and make sure that we're educating them in a way that provides real tangible changes that they can make. So thank you all so much for being part of that panel and digging in and really getting into the weeds on that. I would also like to acknowledge Dr. Courtney Melton-Fant. She played a very critical role in this report. She's the author of the Sycamore Institute report that took place in Tennessee that kind of inspired this one. And then she's on the call with us today listening in, but she was critical in the development of this report. Really, really appreciate the intellect and the experience that she brought for us to help to develop this. Thank you again to all of our attendees of this webinar today. We appreciate you being part of the call, engaging with us. And if you want to revisit the report, or maybe you have a colleague that you'd like to share the information with, we will have a follow-up email with a link to that webinar, as well as the links to the reports and executive summaries. And you'll see that coming pretty soon. And then just something to take away as you all move on to your next meeting, or hopefully lunch, or something where you're getting a little bit of a respite before you jump into the rest of your work today. But as we head into that 2026 legislative session, please consider sending a copy of the executive summary or your main takeaways to your elected official, and sitting down with them during the interim and talking to them about how this looks and shows up in the organization that you work in, and also in your community or in your family or in your broader ecosystem, because they need to know that this is top of mind for us as advocates, and they can take real action to address some of these issues during that 2026 legislative session. So again, thank you so much for being here. Appreciate everyone being part of the webinar, and I'm sure we'll see y'all again soon. Take good care.